Hey everyone, today we're going to talk about how your feet can actually give you clues about the health of your liver. Now, here's my disclaimer right away. This is not a way to officially diagnose liver disease. You still need to see a doctor and get real testing done. But these signs can help you notice a potential problem early and point you in the right direction. So let's get started and break this down together. The first sign to watch for is small red and brown dots on the skin. They can be tiny or a bit larger, and sometimes they even have a slight shine to them. You'll usually spot these on the lower leg, and they're a sign of poor circulation, which often connects back to liver trouble. It could also mean diabetes or something else entirely, but liver problems are a very common cause of this pattern. The appearance of your lower leg and foot actually tells you a lot about someone's overall health. That's because the heart has to pump blood all the way down to the feet and then bring it all the way back up through the vascular system. When there's a liver issue or even a heart issue, you'll often see vascular problems show up in this area first because it's the farthest point from the heart. This is also why diabetes tends to cause nerve problems in the hands and feet specifically. Those are the most distant points from the heart, so they're hit the hardest when circulation isn't working properly. Next, you might notice something called spider veins, also known as spider nevis. These show up a lot in people with cirrhosis because the liver starts producing excess estrogen, and that extra estrogen damages the vascular system, leading to varicose and spider veins. Cracked heels are another clue worth mentioning. This usually points to a vitamin B3 deficiency or a lack of omega-3 fatty acids in the diet. Remember, one of the liver's main jobs is producing bile, which helps your body absorb fat-soluble nutrients like vitamin A, vitamin E, and those omega-3s. Without enough bile, your skin suffers because it isn't getting what it needs to stay healthy and repaired. B vitamins matter here too, since they act as cofactors that help enzymes function properly, especially when it comes to processing proteins. A B3 deficiency is actually known as pellagra, and people with pellagra commonly experience serious skin issues. It's just one more example of how something happening deep inside your body, like a struggling liver, ends up showing itself on the outside through your skin. Now let's talk about itching on the bottom of the foot. This usually means fluid is backing up into the liver, creating congestion. Bile may be backing up too, along with a buildup of histamines, and all of that congestion can cause itching. You might also feel pain or inflammation on the sole of the foot. People often assume this is plantar fasciitis, but a lot of the time it's really a liver issue in disguise. Hot feet are another symptom worth paying attention to, and this often points back to liver dysfunction as well. Then there's bad foot odor, which happens when the liver can't detoxify the body properly. Waste starts backing up and pushing out through the skin instead. This usually means someone's overall diet is unhealthy, and their large intestine and kidneys are struggling too, since these organs tend to decline together rather than separately. Pitting edema is another telling sign. That's when you press a finger into the lower leg and it leaves an indentation that doesn't bounce back right away. This is a very common symptom linked to fluid retention caused by liver trouble. Toenail fungus is another clue, since people with liver issues often have an imbalance of gut flora, which allows fungus and yeast to overgrow on the outside of the body as well. That same imbalance is often behind dandruff and psoriasis too. You might also notice the nail bed turning pale or white, along with the loss of that small moon-shaped area near the cuticle called the lunula. This paleness happens because of poor circulation reaching that part of the body. All these small details together paint a bigger picture of what might be going on internally with the liver. So what actually causes these liver problems in the first place? There are several common culprits. Medication side effects are a big one. Excess sugar, especially high fructose corn syrup, is another major factor. Eating mostly cooked, canned, or pasteurized foods without anything raw puts a lot of strain on the liver and kidneys over time, especially when vegetables are missing from the diet entirely. Without vegetables, your body misses out on enzymes and antioxidants that help protect these organs. Excessive alcohol consumption is another obvious factor that damages liver function. Eating excessive amounts of protein is also a concern, since it creates a heavy nitrogen waste load that can overwhelm both the liver and kidneys over time. If liver or kidney damage already exists, cutting back on protein and increasing vegetable intake is usually recommended. So what does a good liver-supportive diet actually look like? If you're new here, check the link below where I explain how a healthy ketogenic diet combined with intermittent fasting can support liver health. For those of you who have been following along for a while, you already know this approach and you're likely already seeing great results. Drop a comment below so newcomers can see that this really does work. Thanks so much for watching today. If you're enjoying this kind of content, make sure to subscribe so you don't miss anything. I'll keep bringing you more videos like this one to help you stay informed and healthy.